Now moving on to other stories. Former Director of the Ghana Health Service, Professor Agyeman Badu is calling for the establishment of a general supervisory body to resolve the tension between various associations in the health sector. Professor Badu made the call in relation to the recurrent disagreement between the Ghana Medical Association and the Ghana Association of Medical Laboratory Scientists over the years, and the recent event at the Mensha Government Hospital involving the Ashanti Regional Boards of the National Service Scheme. He was speaking in an exclusive interview with JoyNews on the sidelines of the launch of the Made in GMA MTN Doctors Award to mark the 65th anniversary of the association in Accra. The following report has more.
I think it is important that all health professionals appreciate the fact that it is a multidisciplinary team, each holding its own and contributing to the ultimate health of the people. It is important that everybody accepts and knows their limitation in terms of their professional work. I think for me, this is the basic paradigm. If you are a professional, you know the limit to your training and expertise, and you know when to pass on. And even within a set professional grouping, that is why there are seniors, there are consultants, there are subspecialists, and so on and so forth. I think one of the difficulties is that in this country, there is lack of supervision. There's lack of supervision of all professional groupings. And it has allowed people to attempt to do what they like. And in essence, to go beyond what their capacity and capability permits them. And that is why this friction continues. Because I've worked in the UK, I know what happens there. There is no difficulty. Everybody, every professional group knows what they do, and they do it very well. And in the end, the patient gets better. We haven't gotten to that stage yet. And I want to implore all health professionals that we are in a new year.
I will be joined on Zoom by the Public Relations Officer of the Ghana Association of Medical Laboratory Scientists, Dr. Dennis Edu Jesse. Doc, grateful that you could join us. Why the seeming tension between your association and that of the Ghana Medical Association?
Thank you very much. I guess I can be heard.
Sure.
Even in reference to what Professor Agyeman Badu had just said in the interview, we might not only want to restrict it to the medical laboratory science, but then all health professional groupings within the health sector. So I just happen to be speaking, but I don't think from what he said, he specifically had an issue and had maybe pronounced that there is a tension between the medical doctors and the medical...
But that's something that we do see often between all
definitely.
the units.
So
yeah.
I think it's quite okay for me to speak to it, but I want to be fair to my good professor that from just the immediate interview, I don't think it's a continuation of the previous issues. But as we are even speaking, there is something brewing up, even in Convanoche, that things are still not settled. And maybe issues can come up anytime soon if things don't get the way they are supposed to be. But I think that to be frank with the situation, the problem has been, it is not just for the lack of the supervision, but just for the mere fact that professions are not respected. The definitions of what people are to do usually tend to be a problem, where in most cases, other sects of the health service delivery might want to maintain some kind of superiority and with a mindset that everything within the health sector is in the domain of one particular professional group. When that happens, knowing how things are evolving and how things have developed, and if respect is not given to the other arms that are coming up, we will usually have some of these problems all around. Because it's not a legal matter at all. The National Labour Commission should have been able to deal with most of the things that are coming up in the health sector. And for some of us, we fear very much what is the future is going to be, because if we want every other grouping within the health sector come up and want to maintain their superiority, the patient at the end will suffer.
Okay, all right.
We end up breaking into smaller groups simply because others are not respected, people are not allowed to practice their trade, and others think that this thing, I know it all. And for me, that is a bigger problem that we are having. No matter how you have developed academically and professionally, some other groups may want to still see you as, no, you are not doing anything. You are still under me. I control you. I can do your job. I allowed you to do what you are doing. And for me, these things don't happen in other jurisdictions that we are very easy to compare. Regulations work. And unfortunately, when you come here, regulations don't work. We have several good examples that we can learn from. Go to the Christian Health Association of Ghana, the Church hospitals, where the missions have their facilities. They are run smoothly. And you tend not to have some of the fracas and other grudges that you may see in the Ghana Health Service area. Is there something we can learn from there?
Okay.
Are we ready to accommodate that into the Ghana Health Service and the other areas of our health practice? We need to really sit down and come to understand, as Prof.
Okay,
said.
Doc. All right, Doc.
The teamwork, we need to work together.
Great. I'm grateful that you could join us there. Dr. Dennis Edujesi speaks for the Ghana Association of Medical Laboratory Scientists. We'll take a quick